Hi everyone, it's Dr. Adam Dreisman here to talk to you about your 6-week visit after your total knee replacement. So at your 6-week visit, you have to remember that we're on the road to healing that is not fully healed at this time. The example I like to use is if you break your ankle, at this point you're just coming out of the cast. And if you were to expect just coming out of your cast, you're not going to be fully back to your full function. It's still going to be sore, it's still going to be tight. At this point, there's still a lot of scar tissue in place. The scar tissue has a lot of chemicals that brings water into the area, so there's still going to be a fair amount of swelling in there. So at this point, it's still going to be a little bit difficult to get your full function back at this point in time. Talking about your full function, if you're sitting down in a chair for about 20-25 minutes, when you first get up and take those few steps, it's still going to feel a little limpy, a little gimpy. It's going to feel a little bit tight. It takes about 5 steps for that ability to feel like it starts to feel more normal. So if you start feeling like you have a little bit of a limp after the first couple steps, that's very normal common finding at this point in time. Another common finding I want you all to be aware about is that still at 6 weeks, you're going to be feeling a little bit down in the dumps. And the reason why is your blood counts still have not recovered at this point in time. You're still going to be what we call a little bit anemic. Because of that, you're just going to feel tired, you're going to feel a little bit weak. I wouldn't be surprised if you have to take mid-afternoon naps, just because it takes a few months for that blood count to come fully back. Talking about sleeping, and I know this is a sensitive subject, by 6 weeks, it's still very difficult to sleep at this point in time. The Academy typically says that about 12 weeks after the surgery, your sleeping patterns come back. I've actually done some research on this, and looking at our patients, it usually takes anywhere between 6 to 8 weeks. And again, this is just a soft tissue that's very tight, and that just makes it very difficult to get comfortable at nighttime. So I highly recommend that is still at this time, try to keep the swelling under control, still take it easy, don't beat up on the tissue as much, and this should hopefully allow you to sleep at this point. Finally, really at this point, I do want you to come back around 6 weeks at a 3-month visit. Most patients should be feeling pretty good at this time. Usually at 6 weeks, I say most people are off the walker towards a cane. Some people are even off the cane towards not using any assistive device. By 3 months, you're going to be feeling really good. If it's feeling so good, I almost feel bad that making you come in to have you make another copay. But if you feel like you need it, you're more than welcome. But otherwise, I'd have you come back in a year to get new x-rays at that time. So really, main takeaways at 6 weeks is that still going to feel tired because your blood levels are low. Sleeping is still going to be very difficult at this point in time. Still, it's just going to be generally swollen, but you can stop those blood thinning medications because your risk of developing a blood clot is low, and you're going to be feeling a little bit gimpy when you're getting up after sitting in a chair. I hope you have a good recovery. If you have any questions, please feel free to reach out. Thanks so much.